And now it's my honor to welcome Dr. Santóš Samuel Rajpoot from Czech Republic. Dr. Rajpoot is a gastroenterology and Ayurvedic practitioner based in Prague. He will present on integrating Ayurvedic wisdom into modern allopathic medicine. Please welcome, and the stage is yours.
Thank you. So today we will go through the theme of doing Ayurveda in modern practice here in Czech Republic, how it could be done. So my roots are, I was born into Ayurvedic family. My father Govindji Rajpoot and his Guru Data and then Guru Sitaram Baba. This is our parampara. And I practice Ayurveda in Prague, in Kuti. We have like Ayurporadna, it's like Ayurvedic advisory. And for medicine, the roots of the knowledge are from Charles University in Prague. So I was studying Ayurveda and allopathy at the same time. I was born into Vedanta philosophy, not only Ayurveda. So my philosophy was not to find the differences, but to find the things that it is in common. So many people ask always, what is the difference? What is the difference in the meaning of Ayurvedic? How is the view on physiology different? And I always say, don't focus on the difference, focus on the same things, because you can kind of get the information. Then you need to burn the information for it and to kind of change the perception of it and adjust it so it comes. So from Ayurveda, the main concerns is that people take it too seriously. For dinacharya, for daily regime, for ritucharya, for the yearly regime, there is so many things that you need to follow with the regime. But nowadays we're going to work. Nowadays we have digital things around us. So the times has changed. The knowledge is the same. So don't take it as dogmatic as you can. So rising with the sun and everything like this, it could be done, but it's kind of hard in these days. So not to take the dogmatic information out of every verse or shloka in Ayurveda, but take the principles, the core principles of the philosophy, and apply them in 21st century. So this is the way we were taught Ayurveda by my father here in Czech Republic. So you also need to put Agni into the information, need to change the little things in there. So not to focus on the dogmatic view, but focus on the principles that it gives you. So here is the new studies. So new studies are done on Ayurvedic treatment, on the illnesses. So for example, I work in the IBD center. It's a center of gastroenterology in Turnov. We focus on inflammatory bowel disease, on inflammation of the gut, of the bowels. So for the studies, there was used curcumin. Nowadays, even when we go to lectures, every month we have new things, new drugs coming out. We have new therapeutical treatments and possibilities to treat our patients. Each year, each month, there is something new. And last year, when I was visiting this conference, the doctors around the world, mainly from Israel, they are using curcuma. They not use curcuma as like turmeric as a plant, as a herb. They're using just curcumin, like the extract from it, which changes a little bit of digestion, because the digestion, as we know, comes from our eyes, comes from the senses, comes from our tongue. There is enteric system, so what we taste prepares our stomach the way to digest it. And then from our stomach, it prepares the gut and the small bowel, large bowel to digest the food. But as we take just curcumin and it's effective, that's nice. So they use it now. It's also the evidence-based medicine. They use it together with our treatments that we usually use, is just systemic corticosteroids, which is azathioprine, methotrexate, and also biological therapies like infliximab or something else. But there is not still enough data for a single therapy use, so they're a little afraid of using curcuma as a single therapy for the inflammatory bowel disease nowadays. And also there is some data on using shunti for dysfunctional dyspepsia or functional disorders. There is a rise in also IBD and also functional disorders. Functional disorders mean that if you do the endoscopy, if you examine patient throughout the body as you can from allopathy, you do the CT, you do the colonoscopy, gastroscopy, you take all the lab values that you can, there is nothing. Everything is clear. The patient, from our allopathic perspective, he's fine. So we just tell him, there's nothing we can do for you. That's bad, because we don't like to tell our patients there is nothing to do for you, because everything in Ayurveda, every disease is treatable. So I don't say that it will be treatable to the limit that you are really fine, you are in well-being, but some diseases are really tough on you. So it's treatable, but not to relieve everything. So in functional diseases, the treatment is shunti, which we use. We also, in our ambulance in allopathy now, we use shunti. We just write it in the document. And there is also a difference if you use the pills, which you swallow, or if you use shunti or dry ginger into your mouth, which gets digested much more better. And also it's used for upper GI symptoms like pyrosis, like the globus, or heaviness in the stomach after food, or also the lower GI symptoms like bloating, obstipation, or diarrhea. So that's where we use the shunti in functional diseases of gastrointestinal tract. Here you can see even the evidence on using shunti on epigastric pain, postprandial fullness, easal satiety, and the burning, the pyrosis that you get in your esophagus. So there is a really nice decrease at 8 weeks of use. But there is a big problem that I see and I saw when I was studying medicine and Ayurveda together, because we are in modern medicine using evidence-based practice. And evidence-based medicine, EBM, stands for that you take patient not as an individual, because everybody here is different. Everybody here has different properties of their body, of their mind, of the Mahabhutas, of everything. Everything is different between us. To say it in modern words, everybody has different metabolism, different hormone levels. Everybody has different brain connections. So if I say a car, which car you imagine? Somebody's blue, somebody's red, somebody's black. Everybody's different. Not only the mind, but even the body. So this evidence-based practice is taking the patients and making like an average 70 kilogram, 30-year-old people. So they always do the average percentage, and they use this, and they put the drugs. And then they see if it works. But as I could say, it won't, because everybody's different. So if you give drug to one patient and to another patient, one patient could be intolerant to this. One patient could get adverse effects. The others won't. So every patient is original. Every patient, different mind, different body. Everyone is original. So with this, even every medicament is original. So in Ayurveda, most herbs have their properties. So here is Dravya Guna, for example. On Dravya Guna you can have, it's heavy, it's light, it's hot, it's cold. Every matter in the universe has these properties. So even the drugs, not only the herbs, but even modern drugs. So for example, if you use corticosteroids, they have some properties. if you use azathioprine, if you use methotrexate, every drug has their properties. If you use PPIs like omeprazole, pantoprazole, they have also different properties. So you can select the patients which you think, if you have this view, if you have this Ayurvedic goggles, which I say, and you see through the patient, you don't see them just the complaints as a diagnostic list of the diseases he has, but if you see through the patient how he behaves, is he light, is he heavy, is he cold, is he hot? So you can see the patient, you can see the gunas in him, and you can see the gunas also in the medicament, and you can say, I think you will have adverse effects if you take this drug. Or this drug is perfect for you. Not only the herbs, but even the pills. So, for usage of Ayurveda in daily practice, I work in the MUDr center, so we have everything, endoscopies, all of the radiology department, and everything. And we use Ayurvedic treatment nowadays for the treatment of functional diseases. So if modern science doesn't have an answer, we use Ayurveda because we want to help patients either way. And I'm so grateful for my primary doctor to tolerate me in this practice, to tolerate Ayurveda, because it's not that common nowadays. So I'm really grateful to work in this such a nice hospital. And we also use Ayurveda in the prevention. So we don't usually generally nowadays use Ayurvedic treatment in the hospitals, in palliative care, in the ICU, but we use it in the prevention. So it's also nice that there are some general practitioners who are taught Ayurveda and who are using it. There's also, on our university, there's many psychiatric doctors learning Ayurveda and then practicing also meditation, pranayama with their patients, and it has nice effects. And as I said, the thing that Ayurveda gives you is the Ayurvedic goggles. So you see the world in an entirely different way. So if you see it in the 21st century, you see the wall, you see people, somebody smiling, somebody's like, not looking good at you. But with Ayurvedic goggles, you see the gunas of the dravya, of the matter, gunas of the mind, the properties of the mind, and all of these sattva, rajas, tamas, and more. So with these goggles, you can then adjust the medicaments on the point. And also a really difficult task is to communicate with the patient, because communication is key in our practice as a medicine doctor. So every patient is original. There is no patient that is the same as the one before, even though it might look the same, because what we say is patients come in waves, but not patients, the diagnoses come in waves. So if the temperature changes, if anything drops, the diagnosis, because of the dravya gunas changing, there is a different temperature, there is a different pressure of the air. You can see vertigos come in, the dizziness comes into hospital then. But it's not the patients, it's the change in gunas, then change the metabolism, then changing the patients, and then the disease come and they go. So every patient is original. And with this, you also need to change your approach to each patient, because for some, you need to scream because they don't have ears. So you need to scream, you need to stop drinking alcohol. In Czech Republic, it's really common here because you can get beer cheaper than water. And also with this approach, for some you need to be smooth because you see they're really delicate. So also there must be active listening, not to hear the words, but see behind the words, what they mean, why they do it, why they say these words, why they pick from all the dictionary these words, why they talk in this tone, why they are not talking in this tone or this tone. So all of these little things you need to see behind the words. And the future, the little future on a little pinch of sand in this big desert that is the universe, we are building an Ayurvedic center in Ayurpharma Chudíř, it's near Nymburk. And it will be not only prevention, not only spa or wellness, it will be also with holistic approach and usage of Ayurveda and allopathy all together. And in the bigger picture, that is why we are here. And with this, I would like to thank you for the invitation here to this Congress. And I would like to invite you who are in Czech Republic to Diwali to celebrate with us in Prague. Thank you.
Thank you for presentation.